Hello everyone, myself Krishna Singh with a continuation of our third topic, that is peripheral smear. That is the most important topic which is going to asked in every exam. Okay, peripheral smear. That is the most important topic because at least 60% question from a hematology is asked from that particular topic. Okay, so be careful about the topic. Okay, let us discuss. We will describe the two important point here. One is on left side I will write peripheral smear findings. What we are going to see in a peripheral smear, I'll write here. Okay, another side I'll write the condition, in which conditions we got that particular peripheral smear finding. Okay, let us begin. First topic that we have is the microcyte or microcytic peripheral cells. Microcytic cells are smaller cells, okay, with one-third pallor. Okay, these microcytic cells are found in 4 anemias. You can memorize by the mnemonic Sita. Okay, as for sideroblastic anemia, I for iron deficiency anemia. Okay, T for thalassemia, A for anemia of chronic disease, Okay, you can memorize that mnemonic. Okay, there's a Zeta. And second peripheral smear finding is macroovalocyte. Okay, what? Macroovalocyte. Macroovalocytes are larger cells with oval in shape and a little pallor at the site, like that. That is a macroovalocyte, larger than a normal RBC, oval shaped. Macroovalocyte cells are found in 4 conditions. You can memorize that Lady Harding Medical College. L for liver disease, H for hypothyroidism, okay, M for megaloblastic anemia. That's important. There's a characteristic feature of megaloblastic anemia. I think you should memorize that. And C for cytotoxic drugs. Okay, in these 4 conditions, the macroovalocyte cells are found. Okay, now let us see our third peripheral smear finding, that is pencil cells. Okay, pencil cells are rod-shaped cells with blunt ends. You have to be careful in that aspect, that blunt ends of that rod. Okay, the pencil cells are found in iron deficiency anemia. Okay, iron deficiency anemia. And the 4th condition that we have is here spherocytes. What is spherocytes? Spherocytes are small dark condensed cell with no pallor. Okay, what is that? No pallor in that. It is found in which condition? It's found in 4 condition, that is hereditary spherocytosis, second burns, third autoimmune hemolytic anemia, and 4th condition that we have is blood transfusion reaction. Okay, now let us move to our 5th condition, 5th peripheral smear finding, that is burr cells, These burr cells, also known as echinocytes. What? Echinocytes. Burr cells. Suppose this is a RBC. Okay, RBC with the blunt projection. RBC with blunt projection is spurr cells. Okay, you have to memorize that blunt projection. Don't forget that blunt projections. Okay, because we will see the next condition in which there is pointed projections. Okay, burr cells is seen in which condition? Uremia or chronic renal failure. Okay, now let us see our 6th condition. 6th condition that we have is spurr cells. 5th is burr cells, 6th is spurr cells. spur cells. Okay, spur cells also known as acanthocyte. Acanthocyte. Spur cells is RBC with sharp projection or pointed projection. Okay, that is pointed projection. Okay, the spur cell condition is found on liver disease. Okay, liver disease, and another condition that we have is a beta lipoproteinemia. And let us move toward our seventh condition. What was the seventh condition that we have? We have the seventh condition here is teardrop cell. What? Teardrop cell. Teardrop cell, also known as dacrocyte. Dacrocyte. How does a teardrop cells look? Again, that is teardrop. That's like a teardrop. Cute teardrop cells. Okay, that is a teardrop cell. Teardrop cell is found in which conditions? That is A. It's found in myelofibrosis. Second one that we have is myelothesis. And third condition that we have is thalassemia. Okay. Now let us move with our eighth condition. What is the eighth condition that we have? Okay. The eighth condition or eighth peripheral finding smear is target cells. What? Target. Do you know target cells, how they look like? They look like bullseyes. That is target cells. Target. You know, when we throw a target like projection. Okay, that is target cell. Target cell is found in thalassemia. A. Thalassemia. B. Liver disease. And C. What? Megaloblastic anemia. Boom. Anemia. Okay, let us move to our ninth condition. Ninth condition we have is sickle cell. Sickle cell, how they look like? They look like sickle with pointed projection. Okay, the important difference in sickle cell and a pencil cell is that pencil cell there is a blunt projection. That is a pencil cell, okay, with blunt projection and straight cell. But a sickle cell has a sharp ends. Okay, that is sickle cells. Okay, sickle cell condition is found in anemia. That's very easy. Sickle cell anemia. Okay, let us move toward our 10th condition. 10th condition is helmet cells. What? Helmet. Do you know helmet? For driving a vehicle. Helmet cell or fragmented cell. Fragmented RBC. Or another beautiful name we have is cystocyte. What? Cystocyte. You should memorize that cystocyte term for various competitions. Okay, helmet cell look like the helmet. That is a helmet for vehicle driver or two-wheeler driver, cycle driver. Okay, that is a helmet cell. Helmet cell is found in a particular condition, that is microangiopathic hemolytic anemia. Microangiopathic hemolytic anemia. Example of microangiopathic hemolytic anemia are, you guys don't worry about that microangiopathic hemolytic anemia. I will discuss that MAH in a brief discussion, detail, sorry, and TPP or DIC. Don't worry about that. I'll discuss about that in our next video. 11th condition that we have is bite cell. Let me tell you the story, an interesting story about a bite cell. How the bite cell are formed. Okay, suppose I have that red blood cell. In red blood cell, there is a formation of PPTs of hemoglobin. That is PPT of HB. Okay, that is abnormal cell, abnormal red cell. That is a red cell. Okay, when there is a formation of precipitation of hemoglobin or macrophage, come near to that. That is macrophage. And next condition, when macrophage arrives for that abnormal cell for digestion purpose, Macrophage tries to engage that precipitation of hemoglobin, and here macrophage engulf only that part. Which part? That precipitation of hemoglobin. And now the condition is look like that. There is a bite cell formed after engulfing of the red cell by a macrophage. Okay, that is a bite cell. Okay, this bite cell condition you can observe in which situation? That can be observed in glucose 6PD deficiency. Okay, now these cells with precipitation of hemoglobin, these cells with PPT of hemoglobin, known as Haynes body. What? Haynes body. This is also found in the same condition, that is glucose 6PD deficiency. Okay, let us move to our 13th condition, that is Howell Jolly body. My most loving body is that Howell. I love that name, Howell Jolly body. Howell Jolly bodies. Howell Jolly bodies is a remnant of nucleus. What? Remnant of nucleus. And normally RBC doesn't contain a nucleus, but sometimes there is a remnant of nucleus in RBC. Okay, that is RBC. That is remnant. That is remnant of nucleus. Okay, that condition you can beautifully observe in a splenia. What? A splenia. A person with spleen deficiency. No spleen. A splenia or a post-splenectomy or post-splenectomy. And second condition that we have is hemolytic anemia. You can also find the Howell Jolly body in hemolytic anemia. Okay. Now let us move to our 14th condition. The 14th condition that we have is Pappenheimer body. Pappenheimer body. Pappenheimer body is nothing but iron material deposit in that material. Iron material deposited in a lot of iron deposited in our RBC, that is known as a Pappenheimer body. And Pappenheimer body is found in two conditions. First condition is sideroblastic anemia. Second condition is megaloblastic anemia. Okay, you have to memorize these two names. Important question can be asked from here. And 15th condition that we have is basophilic stippling. What? Basophilic stippling. Basophilic stippling, the cells look like that. That is RBC with stipples of basophil stippling. Basophil granules are here. Okay, these conditions, basophilic stippling is found in lead poisoning. What? Lead poisoning. Lead poisoning is a major cause of sideroblastic anemia. What? Sideroblastic anemia. Lead poisoning causes sideroblastic anemia. 16th condition that we have is nucleated RBC. Examiner can ask the two questions here. Let me tell you the nucleated RBC is found in which condition? Nucleated RBC is found in hemolysis. Okay, and 17th question. Okay, let me tell you a little bit about that. Examiner can ask that nucleated RBC, fragment of nucleated RBC, fragmented nucleated RBC is found in which condition? Splenia. That is, remnant of nucleus is different from than a complete nucleus. That is a complete nucleus. You can see here is a nucleus. That is not remnant. That is whole nucleus here. But here remnant. Okay. That's partially digested nucleus. Okay. Just kept that point in mind. Whole nucleus is find the condition. Okay. The 17th condition that we have is polychromasia. What? Polychromasia. Polychromasia. That is purple color RBC. Very topic is a purple color RBC. RBC with purple color. So beautiful, huh? Nice. Purple color RBC or polychromasia is found in hemolysis. same. Okay. Now 18th condition that we have here is raulex or raulex formation. 18th condition is raulex formation. Raulex formation is also known as the stacking of RBC. What? Stacking of RBC. What will happen in this condition? There's a stacking of RBC one by one, like coin like. Okay. This condition is found in multiple myeloma. There's a characteristic feature of multiple myeloma. I think you must memorize that important anemia or disease that is multiple myeloma. Okay, 19th condition that we have is cabot ring. There's a beautiful observation or finding. Cabot ring. You can see the cabot ring megaloblastic anemia, that is megaloblastic anemia due to vitamin B12 deficiency. In cabot ring you can clearly see that suppose this is a RBC with a matrix like that, and cabot ring you will observe that structure. Yeah, exactly same. 8 shape structure. What you gonna see in cabot ring? 8 shaped structure. Okay, cabot ring is a characteristic feature of megaloblastic anemia. Okay, or due to megaloblastic anemia can be due to a lot of causes like vitamin B12 deficiency or folic acid deficiency, but the cabot ring is particularly found in megaloblastic anemia with vitamin B12 deficiency. Don't worry about the megaloblastic anemia. I will cover each and every detail of megaloblastic anemia in detail. Thank you guys. I hope I have completed the maximum part of that peripheral smear finding of RBC. Oh, but I think we should look some other peripheral finding smear of WBC. These all are the RBC. Now let us see the peripheral smear findings of WBC. WBC, a little smear findings of WBC for WBC. Okay, 20th condition. 20th condition that we have is hypersegmented neutrophils. What? Hypersegmented neutrophil. Hypersegmented neutrophils, that is more than 5 lobes. Neutrophils that have more than 5 lobes. Okay, like this is a neutrophil. That is hypersegmented neutrophil. Okay, hypersegmented neutrophil is a characteristic feature of which condition? Megaloblastic anemia due to iron deficiency, same as a cabot ring. You can clearly observe the cabot ring and a hypersegmented neutrophil in the same type of anemia, that is megaloblastic anemia. Sure. Okay, due to vitamin B12 deficiency. And 21st condition that we have is toxic granules. Toxic granules, or dark blue purple stains, or granules, dark blue granules. Okay, and suppose this is a neutrophil with a normal size or hypersegmented neutrophil. You can observe the dark blue granules here. That is a toxic granules. That condition is found in sepsis. Sepsis is an infection of bacteria in blood. Okay, sepsis. And 22nd condition that we have is dohle bodies. What? Dohle bodies. Dohle bodies is also found in sepsis. 23rd condition that we have is pseudopelgar hute. I don't know what type of name is that you have to memorize that. That is neutrophil with bilobed. Okay, bilobed neutrophil. Okay, that is a bilobed neutrophil. Okay, what is that? Bilobed neutrophil. Okay, the condition is particularly a feature of myelodysplastic syndrome. That is MDS. Thank you guys. I hope you like that peripheral smear finding. That is an important topic. I think I have covered almost all of the disease that are related to peripheral smears. Okay, thanking you.